Welcome to Medical Ward, BSN 3B Group 3, Second Rotation NCM 116 RLE, Nursing Care Management 116 RLE, Medical Surgical Nursing, Virtual Clinical Duty. This is gonna be your second rotation, and of course, this is gonna be week 1. And of course, we are going to have our case scenario with patient EF diagnosed with myasthenia gravis. But before that, please allow me to share this premise with you. I am here for you. It's literally my life's work to help you grow. And also, please give me the opportunity to share with you our learning outcomes, which will also be the basis of our expected outcomes at the end of this case analysis. On completion of this case study, student nurses will be able to first build knowledge related to the patient's medical experience. Second, continue to develop a comprehensive assessment and monitoring skills. Third, recommend nursing interventions based on the case presented. Fourth, define the roles and the contributions of the student nurses in the care of medical patients. And fifth, justify optimal therapy based on the current understanding of the case. So this will be the guidelines that we are going to follow at the end of. Of course, this will also be the base for the evaluation of your case analysis later on. It will also be important for you to be guided with the instructions that will be given, especially on the preparation of your output with this case analysis. All critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, and of course, there has to be no flowery words. Next is when asked to provide several answers, it must be listed in order of priority or level of significance. Fourth, base all your answers on the data that is presented and do not assume information that is not provided in the case. Or as much as possible, do not fabricate data. It is also important for you to follow the format of your output, especially on its font style, font size, paper margin, and paper size. Of course, I have given you the format or the template of your output, and of course, you have to follow that. Save it as PDF file and submit all your requirements per group on the date specified as its deadline. Of course, you have to choose your own leader, and of course, that leader will actually be the one who will submit to me the requirements of the group. And of course, you have to submit that based on the specified date later on. Send all your requirements via the official email address of your clinical instructor, and that will be shared after a while. Then, of course, it is advised that you will submit all your requirements on or before the set deadline of submission. Of course, we are going to set deadline for the submission of your requirements. And also, please kindly follow this format in saving your requirements for easier monitoring. For daily requirements, example is abang underscore Joseph underscore W1D1 underscore NCM116 RLE. And of course, next is abang underscore Joseph underscore W1D2 underscore NCM116 RLE. And of course, it follows for the succeeding days and weeks. Next is for weekly requirements. You have to save the file based on the example. Example is abang underscore Joseph underscore W1 for week 1, W2 for week 2, W3 for week 3, and of course underscore NCM116 RLE. Okay, let's now have the case analysis with patient EF diagnosed with myasthenia gravis. Patient EF is a 58-year-old female, a Roman Catholic by faith, married with 8 children, and a retired postal worker of the city, and is currently residing at Barangay Ilaya Carmen, Cagayan de Oro City. She's been admitted in the medical ward of J.R. Borja General Hospital several times. At present, she's been on the medical ward for her scheduled plasmapheresis every other day due to her myasthenia gravis, or MG. A year ago, patient EF started to experience difficulty chewing and swallowing. She also manifested diplopia, and also with slurring of her speech at times, which she thought it was a sign of an impending stroke. With that, she consulted at the ER of J.R. Borja General Hospital and was given an initial dose of perdostigmin with brand name Mistinon. Before this day of admission at present, she had been relatively stable without any symptoms of the condition. Her medical history includes hypertension or HDN, with history also in the family both on her mother and father's side. This history of hypertension present with patient EF was effectively managed with the use of metoprolol or the brand name Loprezor. She also had a history of glaucoma in which the doctor prescribed her to take timolol and ophthalmic preparation. Just recently, patient EF was diagnosed with a sinus infection and was prescribed and treated with ciprofloxacin or brand name of Cipro. Upon her admission at present, patient EF was unable to bear any weight or take fluids through a straw. There have been periods of exacerbations and remissions of her case since admission. The vital signs of patient EF are being monitored, and upon your shift, the latest vital signs present in the patient's record are as follows: blood pressure of 170 over 68 mmHg, heart rate of 108 beats per minute, respiratory rate of 24 cycles per minute, temperature of 101.8 degree Fahrenheit, or that's equivalent to 38.8 degrees Celsius. You continued giving care to patient EF, making sure that she will receive the best and quality nursing care from you as her student nurse. You've ended your 2 days duty and you felt that you were able to deliver the best care to patient EF and was able to attend to her needs accordingly. Let's now have the high five critical thinking questions review. Number 1. You note that the nursing assistive personnel has just entered these vital signs into EF's record. What is your priority action at this time? Again, you note that the nursing assistive personnel has just entered these vital signs into EF's record. What is your priority action at this time? Number 2. What treatment do you anticipate for patient EF? Number 2. What treatment do you anticipate for patient EF? Number 3. EF's husband asks you what may have caused my wife to get worse, and why does she keep having these episodes? What explanation should you give him? Again, EF's husband asks you what may have caused my wife to get worse, and why does she keep having these episodes? What explanation should you give her? Number 4, you're visiting with EF's husband, who tells you he doesn't have a lot of information about MG and he would like to know more about it so that he will feel more comfortable talking to his wife. What should you tell him? Again, you're visiting with EF's husband, who tells you he doesn't have a lot of information about MG and he would like to know more about it so that he will feel more comfortable talking to his wife. What would what should you tell him? Lastly, number 5, EF's husband asks you to explain what to expect in terms of symptoms as his wife's illness progresses. What should you tell him? Again, EF's husband asks you to explain what to expect in terms of symptoms as his wife's illness progresses. What should you tell him? Daily requirements. For day 1, day 0, Tuesday, case scenario loading. For day 1, Wednesday, the basic requirement includes a general objective, the SO, DPA duty expectation, your Survey 1, and nurse's notes, FDAR day 1. Initial knowledge about the case, and that includes the physical assessment, the pathophysiology, the diagnostic test, and also your drug study. For day 2, Thursday, basic requirement includes SO, DPA, Survey for day 2, nurse's notes for day 2, weekly evaluation, reflective journal reading, and of course the answers of the critical thinking questions. And also you have to have the initial knowledge about the case, and that includes the problem lists, nursing care plan, and discharge plan. For the weekly requirements, you are going to submit your weekly requirements, and that includes the introduction, the brief introduction of the case. Next is nursing health history, and it will be followed by physical assessment. And of course, it will have also to be followed by anatomy and physiology. And of course, the disease process tracing, which is your pathophysiology. And also that will be followed by the diagnostic tests. And also with your drug study, followed by problem lists, the nursing care plan, the discharge plan, learning outcome, and of course your references that follows the APA style of reference taking. The deadline of submission for your requirements are as follows. For day 1, the deadline is March 3, 2021, Wednesday, 11:59 p.m. For day 2, the deadline is March 4, 2021, Thursday, 11:59 p.m. And for week 1 requirements, the deadline is March 8, 2021, Monday, 11:59 p.m. We are all on our own journey, but in this class, we all need one another and will help one another grow. These are the contact details that you are going to have. My email address is jabang@xu.edu.ph. My mobile number is 0931 0429842, and of course my other social media accounts. This has been Joseph Bahian Abang at your service to make your best even better. To God be all the glory.